Good evening. It's going to be episode one. Coach Vance and Doc uh, coming to you. Going to be coming to you every week. Live podcast. Eventually, you'll be able to call in with questions that we'll be able to answer for you. Uh, and we're going to get right into it. Those of you who don't know me, my name is Coach Vance, certified personal trainer, been in the industry uh, over 24 years. Uh, Love it, passionate about it, all about trying to make people better, get into better health, better shape, the whole nine. So basically, spent years and years of doing things that I really love to do in terms of my passion, health, and wellness. And this afternoon, we have a great friend with me, Dr. Hodges. And I want Dr. Hodges to introduce himself, tell the audience a little bit about himself, and then we're going to kind of jump right into the subject that we're going to discuss tonight. Doc?
Well, thank you, Kareem. Not only are we friends, we family. So,
Yeah.
um, um, I've been in practice in Memphis, in this Mid South area, for 20, 25 years now. I practiced as an OBGYN up until 2017, delivering babies up until 2017. Um, and in 2020, I started my current practice, which is Southwind Gynecology and Wellness Center. Um, we do hormone therapy for men and women. We do weight loss. We specialize in weight loss, hormone therapy, and just helping people to overall improve their wellness. My passion for this, as I said, I was a practicing OBGYN since 2000, and the first my first interactions with women or with patients and their weight were that I would see a patient. She'd come in, um, 18, 19 years old, have her first baby, gain 40 pounds with that pregnancy, lose 20 of it after, um, get pregnant again, gain another 40, 50 pounds, and then lose 20 or 30 of it after. But what I would generally always see is that um, they would never go back to their original weight, number one. And then number two, with each subsequent pregnancy, more weight will be added on. And generally, by the time they finish having their kids, their current weight, and a lot of women will probably attest to this, their current weight will be more than what they weighed when they were 40 weeks pregnant with their last baby. I always say, you know what? When you had your last child, you weighed 205, and today you are here and you weigh 245.
Right.
You know what I'm saying? So, um, weight, just like blood pressure, um, temperature, um, heart rate, is a vital sign. And it's one of the early vital signs. It's the canary in the coal mine, as we can call it. That's going to tell us what's to come next. And when I say what's to come next, I'm talking about the hypertension, the diabetes, and the other chronic illnesses that ultimately shorten your life.
Right.
So, you know, I've always, with my patients, have kind of tried to talk to them about, okay, um, you see where your weight is. What are you doing to stay healthy? Are you watching what you eat? Are you exercising? Are you, And I would encourage um, those patients. I always you always have to look at the community they live in. So for a lot of time I was in Whitehaven, so I would say, well, you got the YMCA down there, and they're income based. So even if you don't make a lot of money, you can get a family membership. The
Right.
kids can swim in the pool. you can go to a class,
Right.
you know, and so you can encourage that type of lifestyle and that kind of fitness in your into their life, and try to encourage them to do those things.
Right.
So there's Planet Fitness in the in the area. Say Planet Fitness is cheap. You can, you know, $10. You can have access to a gym.
Right.
So, you know, I would always try to point them to those things. And if you can't do any of those things, you can always get out and walk.
Right.
So it's important to give them an option, or show them ways that they can help improve their own health, make them a partner
Right.
in taking care of themselves. Then and along with that, for many years, you know, I prescribed phentermine. Phentermine is a weight loss drug, but it's a stimulant. So, you know, some patients can't tolerate it. It's cheap, so that's the great thing about it. It is cheap.
Right.
But, you know, for some patients, it can cause elevation of their blood pressure. For others, they just have the elevation of the heart rate, or the dry mouth, or the other symptoms that come along with it, insomnia, that makes it intolerable for them. You know,
Right.
so when the newest class of medications came out, they were truly a game changer as far as weight loss, for our for the whole, for society.
Right.
The GLP-1s, as they call them, glucagon-like peptide, type class 1 medications, have definitely changed the game as far as weight loss is concerned. And for all my patients that have BMIs greater than 30 now, I try to I talk to them about the use of them, and for those who can afford them, or who have whose insurance pays for them, I tell them, I say, hey, let's look and see if we can get it paid for. Let's try it. And for most who try it, they see success with it. So, you know, if you're gonna be successful, or if a patient's gonna stick with something, or even if you have a client, if they're gonna stick with your program, one, they have to see that it's working for them. They have to see some results, some tangible results, you know. And if they can see those tangible results, they're willing to stick with you and try to and work with you to help them
Right.
improve their health. So that's the one thing I could say about the newest medications, is that they do work.
Right.
For all patients. I haven't seen anyone that they don't work on. Now it may be dose dependent, but at some point, you know, we can affect weight loss if we get them at the right dose. So.
Right. So let's talk a little bit about that, and let's talk a little bit about, you know, diabetes, and there are certain medication for several years been prescribed to patients to treat diabetes, and then came the quote unquote weight loss drugs, and there's this theory that the diabetes drugs was helping people lose weight, so then they approved it to be a weight loss drug.
Yeah.
So I want you to kind of explain to the audience the difference between the diabetes drugs and the weight loss drugs, or if there is a difference, and how the GLP-1s came about. And
Well,
based on, let's start with the diabetes drugs first, and then go from there.
So there's several classes of diabetes drugs that can be used. We have drugs like metformin, which is one of the older but still effective drugs that are out there, and a lot of people consider metformin as first line therapy for diabetes. Metformin is what we call an insulin sensitizer, and what it does is it sensitizes your body to the um, insulin that it produces. So it makes your cells more efficient for absorption of glucose by sensitizing the cells itself to absorb to take in the glucose. Um, you got oral sulfonylureas, which are drugs that or what we call oral hypoglycemic agents. These drugs lower your blood sugar by forcing glucose uptake into your cells as well. Um, so those drugs are what we call oral hypoglycemic agents. They're some of the older drugs. They're not necessarily used um, as primary therapy. And then this newest class of drugs, the GLP-1s. There are other classes as well. We're not going to get into all those, but this is not a pharmacology class. But
Right.
but then the GLP-1s, which are out, they've been out since about 2005. But the earlier GLP-1s were drugs that you had to use daily.
Right.
So those drugs you had to give yourself a shot every day. The newer drugs, Ozempic and Mounjaro, which are two of the newest drugs that are out there.
Probably the most
Ozempic, and two of the most popular. Two that pretty much led this way. I think Ozempic came out somewhere around 2018, 2019, and it came out initially as a diabetic medication. What it does is it causes your body's pancreas to secrete more insulin, but it also decreases your appetite by slowing gastric emptying. And GLP-1 means glucagon-like peptide. Glucagon is a hormone or peptide, a hormone that your body produces. And when your body produces glucagon, it's telling your body that there's glucose around, and that your pancreas needs to make some insulin and things like that. So by this hormone that acts like glucagon, it's telling your body that I got plenty of glucose around. I'm full. So when that happens, it slows your stomach down. So you don't even if you haven't eaten,
Right.
even if you hadn't eaten, you don't feel hungry because if you do eat, your gastric emptying is slowed to a point where you feel full for much longer. That's number one. And then at the same time, it works in your brain. Right. So it's these hormones go to your brain too. So if you're hungry, then you get these signals from your brain saying you need to go eat. Well, this hormone is the I'm full hormone of I've eaten enough.
Right.
So this hormone, we're giving it to you, it's telling your body constantly, I've had enough. Right. So you're not eating. So patients lose weight. Right. No matter what, they lose weight. They don't feel the urge. We were talking a few days ago, and you said something about hunger noise or food noise. Right. That's the newest way it's been described, but it does it quiets the brain from craving the sugars and the snacks that we often do crave when we get hungry. That leads us to make poor food choices quite often.
So let me ask you this, and we touched on Ozempic, originally a drug to treat diabetes. Okay, so now we have what we see as being weight loss drugs.
Wegovy.
Okay, so with the weight loss drugs,
Mm-hmm.
as a physician, how do you determine, let's say, if they're diabetic,
Mm-hmm.
do you put them on strictly the diabetic medication? And if that medication is not helping them lose weight, do you also prescribe another GLP-1?
So the short answer is no. I generally do not put patients on two different GLP-1s. You know, that's me. There are probably some obesity physicians out there that do treat patients with more than one GLP-1, but I have very few patients that I've put on two GLP-1s. The diabetic drug, if they're diabetics, then they get treated with the Mounjaro or the Ozempic. Those are the drugs that we choose to treat them with if they're diabetic. If they are obese, having a body mass index of greater than 30 milligrams per kilogram, which is the technical definition for obesity. So if they have that BMI of greater than 30, then they qualify for the weight loss medication. So the qualification generally for the diabetic medication is that they have to have a hemoglobin A1C greater than 6.5. Right. If they have a hemoglobin A1C greater than 6.5, we can generally get them approved through their insurance company for the Ozempic or the Mounjaro. If they have a hemoglobin A1, if they have the BMI of greater than 30, but their hemoglobin A1C is less than 6.5, then we generally tend to try to get them approved for the weight loss medications, the Wegovy and the Zepbound instead of the Ozempic and Mounjaro.
Okay. So let me ask you this. Have you experienced patients that have came in, you described the weight loss drugs to them,
Mm-hmm.
And they have some success, they lose weight,
Mm-hmm.
and if they stop taking the weight loss drugs, they gain not just their weight back, but even more. Similar to what we talked about earlier with some of the pregnancies after ladies have maybe had a child,
Right.
gain more weight back.
Right.
So if they gaining more weight back, is it the drug that possibly will cause that, or what would be your analysis of that if you experienced that? May not have
Well,
experienced.
they've looked at it. They've done studies. So the studies that have been done for these drugs state that if the patient and they've looked at Wegovy, which is semaglutide or semaglutide, as some people call it. Wegovy, semaglutide, and Ozempic are all the same medication, okay, the same drug. So let's start by just giving their names as compounds. Semaglutide is Ozempic, which is also Wegovy. You know, basically what the pharmaceutical companies did was they took the same drug and got it remarketed or went to the FDA and said, look, this drug right here, or this drug, Ozempic, what they did was they saw that people that were on Ozempic lost a tremendous amount of weight. They said, hey, maybe we could sell this as a weight loss drug.
Right.
So then they went back to the FDA and said, well, we want to get an indication for weight loss. And then they rebranded their same drug as a different, in a different box and everything like that, so that they can get that indication as well. So now Ozempic has only one indication, that's for diabetes. But Wegovy has an indication for
Weight loss.
weight loss. Right. Ozempic also has an indication for chronic kidney disease. They did get an indication for that. Think they've got an indication for non-alcoholic fatty liver disease. So they have a couple of other indications. And Mounjaro, which is tirzepatide, or tirzepatide, which is Mounjaro and Zepbound, they have indication. Zepbound has an indication for obesity, but it also has an indication for sleep apnea, obstructive sleep apnea. So these drugs they're really amazing medications for the amount of things that they've seen that they can help treat. Addiction, they're looking at them a lot in addiction therapy, because what they have seen is just like they decrease the amount of desire for food. They also seen that people who take them have less of a desire to drink. So they're looking at it for treatment of alcohol. It doesn't have an indication at this point, but they are doing studies on it. So they've looked at it for a variety of for different uses, and what they found that although it has indications for either obesity and diabetes, these things decrease the inflammation in the body. Osteoarthritis in the knees, they've seen they have data that shows that they improve osteoarthritis in the knees. They increase inflammation overall throughout the body. So they have a plethora of benefits that go beyond just weight loss.
Right. So, throughout my years of training, working with clients and, all different levels, I often get clients to come in and say, I'm thinking about taking this, I'm thinking about taking that, whether it's an over-counter weight loss drug or whether it's something their doctor prescribed. And they have asked me about, hey, what you think? And I've always initially said, hey, we're going to try a exercise program that we're doing, and we're going to try to put you on, the right path of nutrition. I won't even say diet, but just the right path of nutrition. And the clients, two different type of clients I've dealt with. I dealt with some that have taken weight loss medication. I dealt with some that didn't. And the ones that did not take weight loss medication, they still got results. They still reached their goals and things of that nature, right? The ones that took weight loss medication, they also reached their goals. They also got results as well. But the one thing I did experience is the ones that often took something over-the-counter medication, was on a specific diet plan, not a nutrition plan, but not a lifestyle change, but a diet plan. The ones that was on a specific diet plan, taking any type of medication over-the-counter or prescribed, what I've seen, if they did not have a routine exercise program that they was doing consistently, I saw when they came off of that particular diet or that particular medication over the counter or prescribed, they tend to have gained more weight back, as opposed to the clients that was on a routine, a nutrition plan, and a routine exercise program that was designed for them. Those clients had better results of keeping the weight off long term than other clients. So what is your experience, or what is your recommendation to patients that come in that that's not exercising, don't like to go to the gym, just say, okay, doc, I'll take this, and they start to lose that weight, and they haven't walked outside, they haven't did anything, and often they still eating kind of what they want when they're ready to eat, as opposed to more healthy balance. So what would be your recommendations, or how would you get those patients or clients to see, hey, a exercise program and the right nutrition and balance is going to be the the best results for your long-term success.
Okay. So a couple of things. One of the questions you asked me earlier was about the rebound weight gain. Um, and I went into it and said they did some studies on what they found was that when patients come off of these medications, many of them will gain weight, but most of them will not get back to the weight they were. And what they've seen with these medications is that they can lose as much as 20 to 25% of their body weight, which is significant.
Right.
You know, so we're talking losing 60, 70, even 100 pounds for some patients. So they can lose significant amounts of body weight, and they may gain some of that body weight back, but they generally, even if you go a year out, let's say that they took it for 6 months, and then we look at them a year from now, and they took it for 6 months and they're off for 6 months. Most of them will still be at least 5% lower than their initial starting weight, and that's significant.
Right.
5% weight loss is significant. So
with or without a program, exercise program.
even without exercise program. Right.
So with a program, numbers will be much better.
So with a program, if you use it for 6 months and you also have initiated an exercise program. So I always tell my patients when I put them on medication, you need to exercise because sometimes the weight loss can be so rapid that you do lose muscle.
Right.
When you're losing more than, let's say, 6, 7, 8 pounds a month, which these drugs can often cause, significant weight loss, 10, 15 pounds in a month. So when you're losing that kind of weight, there's definitely going to be some muscle loss as well.
Right.
So, there are two things I try to tell my patients when I put them on these drugs. One is your diet should consist of high quality protein, salmon, things like that, chicken breast. So your diet should consist of high quality protein more than anything, and your fruits and vegetables. But you should make sure you have adequate protein intake, and then I try to encourage weight-bearing exercise, weightlifting. But if you're not going to go to a gym and lift weights or machines, because many of them have never exercised in their life. So that's the thing about getting into a gym or going into that type of environment, especially for those who've never done it, is that it can be very intimidating. We know this, which is why oftentimes, if they can afford it, a trainer is great.
Right.
But if you can't afford it, I still say, look, even if you can't afford a trainer, go to a gym. And the thing about a gym, it's like a community.
Right.
People will assist you. They
Right.
will help you.
Right.
If they see that you don't know what you're doing, one, you can ask. Oftentimes, many of these big box gyms will give you a free session, but the machines are really, really simple. I don't try to tell somebody who's never done weights to start doing free weights.
Right.
Just get on the machines. Follow the little row of machines around. So if it's chest, then do the chest press. Right. If it's an overhead press, do the overhead press. Right. And those machines are pretty safe because they have a limited range of motion. So, you have to be doing something really dumb to hurt yourself doing machine weights. Right. And you can start low, build yourself up as you can gradually increase your weight and your resistance levels. But if you just do a few machines and learn how to work to do exercise with those machines, you can fight off the muscle loss, number
right.
one. but you're also starting a program and doing lifestyle interventions that over time, if you continue to do them daily, are going to turn into habits that lead to lasting weight loss and lasting lifestyle changes that create a positive effect for you overall.
Okay, we're gonna wrap things up here with session one of the podcast with Coach Vance and Doc. Next episode, we're gonna go a little further in depth, and we're gonna have special guests to come on, and we're gonna talk about the pros and cons of weight loss medication, and the pros and cons of working with a personal trainer as opposed to not working with a personal trainer. But for now, that's all. God bless.
God bless.